Hello, everyone, and welcome to EllieMD's live educational series. We are glad you're here as we dive into another powerful conversation designed to educate, inspire, and empower you on your health journey. Today, we're going to talk about men's health. This is our men's health series number 2, which is dedicated to exploring men's health more deeply from hormone optimization to energy, performance, and longevity. At LEMD, we go beyond telehealth. We're building a community grounded in education, innovation, and personalized support. And this series is one more way we're equipping you with the tools, knowledge, and strategies to thrive at every stage in life. Today, we're excited to welcome back Dr. Jason Pensac, a board-certified nurse practitioner and chiropractor who blends traditional and integrative medicine to deliver whole personal care. Dr. Pensac began his career in nursing before pursuing advanced training in chiropractic medicine, peptide therapy, hormone optimization, and longevity treatments. With more than a decade of experience and a strong clinical focus on GLP-1 based therapies, he has helped patients improve metabolic health, achieve sustainable weight loss, and live stronger, healthier lives for years to come. Jason, welcome back. Welcome back to our men's series. This is your first
Well,
time. Welcome, welcome. Thank you for being here. So, can you talk to our men and tell us a little about yourself, why you're passionate about what you're doing, and tell us a little about you?
yeah, of course. My journey started maybe 8 years ago. I've been practicing for probably 2 years already. Tired, fatigued, like a lot of men out there, and I was only 32 and just felt like all my workouts weren't really getting me anywhere. I was taking naps a few times a week and just not feeling great. And even though I was trying to push, and I kept saying I wanted to be stronger, leaner, faster, better brain function, better sleep, all the things we want, better energy. I couldn't get there. And I started working on myself. I was doing IV therapy on myself probably weekly when I first started practice. And I realized that's not sustainable for anyone out there. And I accidentally found peptides through my friends who wanted to get put on growth hormone and steroids. And they asked me if I could figure out how to help them out. So I stumbled upon growth hormone peptides. In fact, we'll talk about a few of them today. And I found that they were really useful. So I started using GHRP2, GHRP6, and at the time, Tesamorelin, which make you very, very, very hungry. And I started using some testosterone at the time, and all of a sudden, my napping went away, and I was no longer tired. It was usually just little hormones, and little growth hormone made a massive difference. And then I just have kind of pursued the hormone route and the peptide route for the last 8 years now, and just seen quite amazing things in my own health and vitality. I feel and look way younger than I did 8 years ago. I'm stronger, better, faster, smarter, bigger business. Everything has improved in the last 8 years from where I was. So I do think it's part of my mission to make everyone, or at least allow everyone to have the education and ability to get themselves to the point they can feel better in their own bodies.
And someone wrote, and a fresh haircut. That's just
Fresh
your.
haircut too. Yes. Just for
Aw.
this call today.
Well, I know you have your own clinic and practice. I want to
Mhm.
ask you just to set the stage, what are some common issues that you're seeing in your practice, some trends that you're seeing amongst men, and what do you think is contributing to that?
Yeah, I mean, one of the most common things we see is fatigue, poor energy, people just, having hard times losing weight, and contributing factors, right? High stress jobs. Men are not sleeping enough. We're staying up late. We're trying to push the candles at both ends. Nutrition is awful. We're eating garbage food, all this processed food we have. We're not getting enough exercise. So basically, we're missing the pillars, right? Nutrition, diet, and then exercise, and then sleep is a big one too. And if we're missing those, we're going to not feel great. Sleep is a big thing for recovery, repair. A lot of my men are coming to me, they're getting older. I'm like, I can't recover like I used to. And they're coming to me with poor sleep. They're saying, I'm eating pretty awful right now. I'm still drinking quite a bit. And I have to remind them, hey, if you don't start moving these things in the right direction, I don't care how many peptides, hormones, anything I throw at you, these, don't get me wrong, these things will help aid them in stopping these behaviors and moving in the right direction. But unfortunately, I can't out peptide or out hormone a bad diet and poor sleep.
Okay, so let's talk about nutrition real quick. What effects does it have on your hormones, on your overall health? Um, let's start with the food that we consume, and then we could talk about sleep and everything else.
Yeah. These high processed diets that we are now eating, when you look in the back of a in kind of wrapper when you go into the store, there's gonna be a lot of things on there. If you can't pronounce it, don't put it in your mouth. That's my kind of trade secret there. So there's a lot of things in there we should not be eating. I try to teach patients to eat on the outside of the grocery stores. If you walk in the grocery stores, all the fresh stuff is on the outside. Everything on the inside is processed. Now, there's a time and a place to eat processed foods. I'm not saying that, you have to cut all to zero, right? That's not realistic for most people out there. I do encourage people to eat a lot less processed foods and increase your protein content, whole proteins. We want things such as meat, fish, chicken, or if you're vegetarian, we're looking at beans, or the plant-based options to improve your overall protein input. So I'm trying to get my men, like I try to get my women, to eat more protein. That's number one. Protein is thermogenic. It is much harder to burn, which means you're going to burn a little warmer from it. It means more calories burned from doing a higher protein option. And I'm not saying high protein diets where we're eating 2x, 3x our body weight. I'm just hoping people can eat near the body weight at zero point 0.8 to 1 milligram, 1 gram of protein per pound of body weight, ideal body weight. This is what you would want to be, right? If you're 200 pounds and want to be 180 pounds, I don't want you eating 200 grams of protein a day or anything close to that. So I do recommend when it comes to diet and nutrition with anyone out there, when you take foods away from people and you start taking things away, it's a lot harder to maintain, right? The problem is when you get to eat more of something, you usually thrive. So I'm always like, hey, eat more fruit. I want you to try to eat more protein. I want to give back to people instead of saying, hey, processed foods are terrible, take it all away, stop eating this tomorrow. Hey, gluten and dairy are awful, cut it out. And not that I'm not encouraging that when I speak to my men, but I am being realistic because there's absolutely no way that anyone out there, going from one day to, the day after they talk to me and just change everything, right? That is unrealistic. So, the very least, I want you to cut out processed foods and I want you to eat more protein and drink some more water. Very simple things to start.
And then if you could quickly touch on the environmental toxins and plastics and so forth and how
Oh,
hormones, can you
that's
just
like a,
quickly?
that's like a can of worms right there trying to get me.
I know, that's very
Um, I mean, you can just look back, even Fukushima a few years ago, causing radiation to the ocean. Like we've had poison in our water system. We have microplastics. We have drugs in our water supply. It was so funny. I was at a wedding this last weekend, sitting next to a guy. And he said something about, but I drink all the tap water every day. I was like, wait, you still drink tap water? Dude, we're in Chicago. You don't drink the tap water. Like, what are you doing? This is poison. And he just couldn't, he's like, well, what do you mean the tap water is poison? I go, there's microplastics in it. There's drugs in it. There's actually, chemicals in there that are poisonous. And you go online, I can't remember the site now, but there are places to look at your water supply and determine how bad your water supply is. This is simple. Get a filter. You can put it under the sink. You can filter your water very easily. I'm also telling people I have a glass filter at home, so I have my water filtered with glass. Though now they even say glass bottles have as much microplastic as plastic water bottles. I still recommend no plastic bottles whenever necessary, but again, microplastics, and now we have nanoplastics, which get into the cells. So we're just full of plastic, unfortunately. But the realistic thing is these are causing inflammation. All the things in our environment right now are causing more and more inflammation, which is part of the reason people are having a hard time losing weight, right? Our diet that is controlled by the FDA and they're allowing all these different chemicals in there. Thankfully, I gotta say, since RFK, we have been pulling out things out of the diet. Some of the diets have come out, they're reducing the chemicals that are in some of the foods. Other countries don't have this. I think if anyone in this group has traveled outside the country before and has some kind of allergy to dairy or gluten or something else, you could eat these foods outside the country. And it's because they don't do all the different pesticides, herbicides, and all the stuff in the food that we do. So you can go out of the countries and they don't even have some of these dyes aren't even in the food. So it is really hard because the FDA has allowed all this for years and years and years, which has allowed people to get more and more sick, which controls how many drugs we need, right? You get heart disease and you get type 2 diabetes, now there's a drug for it, right? So if the food's poisoning you and now you have a drug for it, and the FDA controls both sides of, hey, we control the diet and food, and we also control the drugs you're getting, Well, who's standing to gain from that, right? The people, the FDA is getting money from both sides. We have lobbyists that are paying for the food industry saying, hey, we actually, this stuff's safe. It's fine. Don't worry about it. We did the study. Our company did the study. It's totally safe. We think it's safe. Well, if you're making the study, you have incentive. And the drug companies, don't worry about it. We got a drug for it. Well, good. It's chill. It's okay. So it is really hard. There's a lot of environmental toxins out there now. We do a test that does heavy metal testing, line mold, and herbicides and pesticides in our patients for kind of a total tox burden to see kind of what toxins you even have to get an idea of what's in you. This doesn't test for the microplastics you have in your system, which is another huge thing. And there are only a few ways to get it out. Plasmapheresis is one of them. You can pull it out. It's expensive treatments. And unfortunately, at this point, this stuff is already in our supply. So mitigating is the best thing we can do. Doing things that are anti-inflammatory, things such as GLP-1s that can reduce inflammation. These now kind of become, I think, stream because we don't have an option to reduce inflammation. I get posts all the time, people just change their diet, all the inflammation will go away, and that's just not true anymore. I'm sorry, but even if you have a perfect diet, people still are going to have inflammation. That's just what's happened with the toxic environment that we live in at this point.
And how about hormones? Can you touch on
Yeah, I mean, there's lots of hormone disruptors.
testosterone and
Yeah. A lot of hormone disruptors. And we've seen testosterone in men has dropped 40%. So for the men out there and for the women that love them, just so you know, the average testosterone level in a man in the 40s was about 750. Now it's about 450 or so. Sorry, 700, 450 now. So we've seen a drop pretty significantly from men's testosterone levels. What does this mean for men? It means we feel less like men. I always tell men that the testosterone is what makes you feel, more of yourself, right? Motivation gets better, sleep improves, brain function improves. We have improvements in fat loss and muscle gain. Energy in the afternoon improves. Anxiety and depression improves. I had a patient that called me today. He's been on testosterone with me for some time. He stopped taking it. He got hospitalized or something recently, so he stopped taking his testosterone. He went from 950 to 200. This guy has my personal number, unfortunately for me right now, because he's been texting me every single day, multiple times a day for the last like 2 weeks. I pulled his labs. I'm like, sir, you have testosterone 200. Now, if anyone out there, 200 is a blab low. This is a very, very, very low number. And I said to him, part of the anxiety you are feeling right now is directly related to the amount of testosterone because you weren't like this a month ago. And he's gotten so anxious. And I see this with men and with women. Women, you guys need testosterone too. You just need this tiny little bit. But men, it's kind of it's who we are. It's our essence, right? And I tell everyone out of all the hormones I work with, testosterone is the biggest one. And we have all these testosterone disruptors, endocrine disruptors now that are from the environment, and it is really hard to get away from. Step one, just don't drink tap water. Like that's the minimum I'm asking you. Just don't drink tap water. Stay away from plastic bottles. Those are like the minimum I can ask patients to do. And then get away from processed foods. Because we don't want endocrine disruptors in our lives and we're exposed to them all the time. The paper you get from the grocery store that you grab, it has a basically increased estrogen. Like just that alone, just grabbing. I don't even grab the in the receipts anymore. I'm just like, no, you can keep it. I don't want to touch the receipt. I don't want to touch it. I don't want my skin. I don't want any of this stuff. So, we're seeing higher levels of estrogen in men, and lower levels of testosterone. And this is happening to women as well, right? I mean, I don't have studies. We haven't studied women for testosterone. It's not on label for women, unfortunately, even though they need it. But I will say there has not been good studies showing the decrease in women, but I would guarantee that's happened the same way as men. We just don't have the data to back it up because men, for a long time, unfortunately, ladies, that's all we cared about in medicine was just men. A lot of drugs were tested just in men, not even tested in women. Ambien is one of these ones that we know for sure wasn't tested in women. And all of a sudden they found women don't metabolize as well. So women wake up in the morning and get into car accidents or be in dangerous situations because they weren't processed fully for Ambien because it's only tested in men. So have left women out for many, many years in medicine. And unfortunately for that, women don't get testosterone or talked about as much. But again, it's a men's hormone. We always think men, we think testosterone. And I will say men desperately need more levels. 400 for me, 450 is a low number of testosterone. I'm looking for 800 to 1,000. That's my goal for my men. And if the average is now 450, it's just not good.
okay, so if I'm a man and I have lower testosterone levels, which is natural also as you age, right? We're
100%.
we're seeing an accelerated decline
Correct.
in testosterone levels, but some of it is normal. If I am a man and I don't want to go on hormone replacement therapy, I don't want to inject myself with testosterone. What are natural ways besides stop drinking out of the tap? Besides that, and making some adjustments with our food, are there natural supplements we can take? And then the next level is, are there peptides that we can use?
True. Yeah. There's a few options, right? Better sleep. Number one factor for testosterone, sleep. We must get better sleep. Again, some men just don't get good sleep in general. They just poor sleep as you get older. As you get older, sleep goes down. You don't have a good quality of sleep. So this is where something like a Tesamorelin, Ipamorelin can come in, or Sermorelin, or CGC Ipamorelin. Any of the peptides that increase growth hormone are going to help sleep, which will help men produce more testosterone. Um, you can also do things such as exercise. Exercise improves testosterone levels. Those two things alone get some of the biggest bang for your buck for testosterone levels. You need to exercise some, but it is a catch-22. If I'm too tired to go to the gym, I'm too tired to exercise, I can't get in them to get my levels better. So again, helping sleep is a big thing for men. Secondarily, there are some supplements. There's maca root, zinc is going to help, magnesium, fortigrush. There are some things. I'd say probably if I picked all the supplements and put them in one big pile and just said take this whole handful of pills every day, which as a man, as any human, I don't want a bunch of pills. So like that's really hard for me to stomach. But even all the stuff put together is going to get you maybe 150 points extra. So even if you get better sleep, if we improve your workouts, if we improve all the supplements we could possibly do, we're still not looking at a big increase. We're not getting you back to 800 to 1,000 with just that, especially for the average man. So even with all that, now that's going to improve. And I'm not saying that's not enough, but it will improve. Even if you take Tesamorelin, Ipamorelin, it'll help your testosterone levels. Unfortunately, as you get older, we just need to start doing things to improve testosterone. I like to use something called enclomiphene or Clomid in practice. There are a few peptides that work. HCG is one of the peptides we use in men. For women, this is what happens when you pee on the stick to tell us you're pregnant. It's HCG we're looking for. It goes up in women when they're pregnant. This is actually something we use to increase testosterone levels in men. There's kisspeptin, which works in men to improve testosterone. It also works in ovulation in women and can help improve testosterone in women. We use it for fertility in women. It's also something that actually GLP-1s can improve kisspeptin. So there's some research showing that GLP-1s will increase fertility by working on this kisspeptin in women. There's gonadolin, also can improve testosterone. And then there's DSIP, which is delta sleep initiating peptide, which can increase testosterone. So I have a multitude of options. As you get older, though, honey, you're right, levels just go down. So if you're a 20-year-old man and then you see a 40-year-old man, I can almost guarantee that 40-year-old man is going to have lower testosterone across the board. I am seeing lower testosterone in men in their 20s now. Something in my first year of practice I wasn't seeing as much, and now I'm seeing more and more and more young men coming in looking to get testosterone, and their levels come in, 300s, 400s, and they're in the mid 20s, which should not be happening. I expect that in my 40-year-olds. I expect to see levels in the 400s, maybe the 500s. And to me, that's still low. Again, we're looking for optimization, right? The whole point of all the stuff we're doing is how to optimize our bodies. Why are we giving patients growth hormone peptides and growth hormone releasing hormones such as testosterone? We want to optimize all the avenues of our body. Aging sucks. There's absolutely no way to get away from aging. You just can't do it. Women, you understand, you're using some kind of face care routine, I'm sure for most of you, almost every single day. And so you get the idea of the aging body. And I know that you put on that lotion every day isn't probably going to make your wrinkles completely stop. Is it stopping you, honey? Have you not had any wrinkles ever since you were in your 18?
Well,
No.
me, I don't have any
Yeah,
wrinkles.
oh, yeah, of course, you're not you personally.
Just
But
kidding.
women, we do this, right? We get into their 40s, we get into our 50s and 60s, and we still age. The skin ages.
Right.
But we do all this work for our face and use all these different products to slow down the aging process. And I think men have a really hard time understanding that. We are underserved in the medical area. We don't like going to the doctor. We don't like seeing anyone. We're the ones more apt to buy online for anything because we don't want to see anyone and talk to anyone. Men don't want to go to the doctors. Women are just better at it. You guys care about your health a little bit more. You do focus on this a bit more than men do. So women understand the idea of longevity already. You have bought into this years ago, and men just haven't. So when I talk to men about this, I start saying things like, hey, your levels of your growth hormone are down, your levels of your testosterone down, your thyroid goes down as you age. We got to work on this. And then the next question always is, look, every person is going to have, well, how long am I on this for? Well, forever. You're not ever going to have these levels come back up. So if you feel better, all we can do is replace this. Growth hormone is one of these things that goes down as we age. By the time you hit 60, you have 10% of the growth hormone you had for men and women compared to what you had at puberty. Testosterone levels start to decrease in men as they age. Thyroid levels start to decrease in men and women as they age. I mean, even women, testosterone levels go down. So all the hormones go down. Women, obviously, you go through menopause. You lose all of your hormones at some point. So my men, I really need to focus on the fact that some of these things will be long term. Whether or not you do it with me or another practitioner, and you'll come on, you'll come off. My goal of every patient I see is, look, I know most likely I'm not going to capture people forever. Like I want to. That's my goal. You work with me, I want to be with you as long as I possibly can. People move, things happen, people stop reordering, they feel better, whatever reason it is. And then they come back eventually and they're like, I felt better doing this. Well, yeah, it's because these are the things that you need as you age. You can keep aging and you can let the aging process happen. You can be tired, fatigued, gain belly fat, get out of shape. Sarcopenia, which is muscle loss, starts to occur. All these things can happen as you age. You can just allow them to happen. That is the aging process. But if you want to live a better health span, which is how good you feel, which is what we care about so much, health span, lifespan, health span. How long do I live? How good do I feel? And I think people care so much about health span. I'll tell you myself, if I end up at the end of my life and I die at, 90, and I could have died at 95, but in the last 5 years, I'm going to feel like garbage and I'm going to be on a bunch of drugs, carry my oxygen tank behind me. Let me go at 90. I just want to go when I'm like healthy and vibrant and everything's feeling good. What's the point of living longer if I'm in pain? I feel awful every day. I'm waking up unhealthy and not feeling myself. So I focus very much in health span. It doesn't mean that these areas don't overlap, right? GLP-1s help health span and they help lifespan. So you can get both at the same time. There aren't therapies I'm using that are slowing down or cutting time out of my lifespan. So I'm not having anything in practice that I typically use for that. In general, there's a lot more. Most of the things that do health span will also affect lifespan positively, such as some of the growth hormone peptides, GLP-1s, even testosterone. If your testosterone is low, we're talking below 350, all-cause mortality, so all risk of death increases. So just giving men testosterone when they have low testosterone can make them live longer.
Wow, that's incredible. Testosterone, look out for it. Now let's talk about lower belly fat, and that's something that starts to happen to men as they get older. And then we could segue into cholesterol and triglycerides. That's
Yeah.
what you want to know about. What causes that, and what can you do?
Yeah. I mean, that lower belly fat happens to both men and women. Men get it too. It's usually hormonal. It could be adrenals, usually. It could also be low testosterone. Those are the two most common problems if your adrenals aren't working well, or if you have testosterone issues, that could be an issue. And growth hormone. Again, hormones. Big, big thing here is hormones. There is something we do have that actually EllieMD has to reduce that belly fat. It's called Tesamorelin slash Ipamorelin. Tesamorelin is known to reduce visceral fat, and it also can reduce abdominal fat. Visceral fat is the fat around your organs. Visceral fat is what causes inflammation in the body. It's going to lead to having insulin resistance. It's going to lead to heart disease, and lowering this visceral fat, which can happen with testosterone by about 20%, is going to reduce all these risk factors. And at the same time, I have men out there who have small, lower their bellies have gone down. So utilizing things that we already have available, growth hormone is really, really useful. But it's part of the aging process. We start to get more of this fat around our organs, fat around our bellies, hormone changes happen. So again, using growth hormone peptides such as testosterone will improve that. GLP-1s will also improve this. Again, typically it's going to be hormonal as we age. It's causing all this. Now, if you're talking about fat in general, obviously this is probably just diet. If we gain fat everywhere, but a lot of people, men and women, will say, "Hey, my belly fat. I don't like this belly fat." And I'll say, "Hey, let's check your hormones. Let's see where they're at, and let's possibly start testosterone. Let's work on the adrenal support because maybe your adrenals aren't working, and also let's get you on some kind of growth hormone peptide to help improve that belly fat as well."
Now, obviously, women go through menopause and they have menopausal like symptoms. Do men have similar type? I mean, obviously not, but are there certain things that men experience as they get older that are just part of the aging process and part of their physical body
I
process?
just read a study today that men in long-term relationships have lower testosterone. So thank you, women. Appreciate you. It's also just another fact here. When women get pregnant, men actually have lower testosterone the entire time their pregnancy goes on up until the baby is done breastfeeding. So there are some effects that actually we get from women, from our partners, that affect our testosterone. Again, these are mild and they can be changed. Um, But to more answer your question, there is no time that men just lose testosterone, right? I have seen, one of my first men I tested in practice was a 75-year-old male who used to be a gigolo in his 50s. The guy was crazy, had this crazy life, was telling me these stories. He had a kid in his 50s, late 50s. His testosterone was the best testosterone I've ever looked at. I mean, he had like an 800 something testosterone, which is massively impressive as a 7-year-old, but he wasn't exposed to the toxins, right? He was that older age, didn't have that in his life. So what we are seeing is that men are starting to see lower and lower testosterones, and it is starting to become like a menopause where you get into your 40s, you get into your 50s, all of a sudden your wife's not feeling good, and it's like this like sympathy, lower testosterone. Like now I just noticed my testosterone sucks. My wife did menopause, and I feel like I don't feel as good. And I do see that with a lot of my men. They might be feeling it beforehand, but they start to notice it more when their partner is not feeling as good. But there is no specific time that can say this is just when it drops. We do see female testosterone dropping around age 30 and starting to go down. For men, it kind of just happens the entire time. So there is no specific time I can say that men just all of a sudden have a drop off a cliff. It just slowly and steadily goes down. I would say though, very commonly I see men in the 30s coming in to see me and their levels are getting low. Typically between late 20s and early 30s when I start seeing men.
So there's no such thing as a menopause. Okay, not a problem.
No, unfortunately, there's not.
Okay, let's talk about erectile dysfunction, low libido. That tends to happen in men as they get a little bit older, or I
Mhm.
mean, it could happen at any age. But can you talk to us about what causes erectile dysfunction and low libido in men
Yeah.
specifically?
So we need to go through the two reasons we have ED in men, psychogenic and physiologic. Psychogenic is going to be, hey, I just don't have the libido to want to have sex anymore. So blood flow works, everything's there, but they don't have the desire is gone. Secondarily, the ability to get an erection is physiologic, so enough blood flow to the penis. Um, as we get older, men have heart disease. It's very common. When you start to occlude or block these arteries and veins, you start to get more erectile dysfunction. You can't get blood flow. So the capillaries, the small little capillaries in the penis, are some of the first places to stop getting blood flow and having blockages. When that happens, you just cannot move enough blood into that area to get a full erection. We do have lots of things for this. I guess a few. The PED5 inhibitors are really good at this. The drugs such as Cialis or Tadalafil, sildenafil, and Viagra. These are your two most commonly heard names. People have probably heard Viagra, the little blue pill. They've heard of Cialis. They're the most common things I use in practice. They work really well. I've also talked before about using nitric oxide. There's a lozenge I really love. Improving nitric oxide is very important. Nitric oxide is going to work on endothelium, which is the blood vessel lining. It's going to help improve that. It's also going to be what increases something called cyclic GMP. So a PED5 inhibitor like Cialis, Viagra is working on cyclic GMP to stop the breakdown of this, to keep the vessels larger. This is what makes, right now I have my veins are pretty big because I take daily Cialis myself. I use it for blood flow, helps improve brain function, helps improve performance in the gym, and then also helps with men with better erections. This cyclic GMP staying around is good. So nitric oxide is the first thing. You have to have more of this to increase the cyclic GMP, and then you need cyclic GMP to stay around because of the PED5 inhibitor, such as Cialis. So doing both is typically what I want to do with the men. Just giving Cialis could be enough, but some men fail. PED5 inhibitors, about 70% of men will respond, 30% will not. And then have that 30% that won't respond could be because they don't have enough nitric oxide. Secondarily, it's also the fact they don't have the libido. So that's the other thing, right? If we don't have a libido, it doesn't matter what you do, you cannot get an erection. So erectile dysfunction starts in men about in the 30s, and every decade, 10% more men will have erectile dysfunction. So it basically will happen to every man across the span of their life. Men hate talking about this. I mean, this is why hymns and these companies exist. They've made so much money because all you do is go on the computer, oh, erectile dysfunction. Cool. Your doctor said you can have it. Yay. No man wants to tell the doctor. It is so hard to get men to talk to me. I have all female nurses that work for me. And I would tell you now, when I have a man in the office, I'd be like, hey, can your nurse like step out for a second? And I'm like, yeah, that's fine. Dude, so I have a problem. My penis doesn't work. What do I do? And I'm like, oh, okay. They can tell you actually better than I can because they hear this every day from me. And I will say that when you start to see erectile dysfunction and it is because of blood flow issues, there's heart disease. So I'm definitely telling men, hey, you probably have some heart disease if you're using this daily Cialis and it's working really well. So this is actually really good for you. I probably said this before at some point on one of these video calls, but um, Cialis, daily Cialis, which is daily tadalafil, can reduce the risk of death from heart disease and stroke by up to 40%. If you want to think of a PVC pipe that's this big, that all of a sudden becomes this big, right? This would into blood vessels. And if you throw a rock down this, it might get stuck. Piece of plaque breaks off, comes down, gets stuck. Now you have a heart attack or gets into the brain, you have a stroke. If it gets to this big, it passes through all the blood vessels, the whole body, gets to the liver, it's processed, kicked out. So the reduction of heart disease alone, which is again happens in men and women. So this isn't just a men only drug. It is on label for men. I will tell women that it is not used in women as of now. Again, I've told you women are not studied in medicine, unfortunately, but it works just the same in women as it does in men. It helps women have better blood flow. So you have better brain function, you have better function, performance, exercise. You also have better sexual performance in women because you have better blood flow to the pelvic region. So better orgasms for women, less painful sex for women. These are things we do see. But again, it is thought of in men and all in men. I do recommend daily Cialis. I think it's amazing. For some men, I'm giving them extra sildenafil. It's a little bit faster acting. It works a little bit better to make a harder erection for men. But then the secondary thing is get your testosterone checked. Man, I cannot tell you this enough. If you have not checked your hormones and you're having some ED, get your hormones checked because it could be as simple as giving you some kind of testosterone booster or some testosterone and erections will come back because you just don't have the libido that you had when you were 20. Unfortunately, guys, as much as you want to pound our chest and think that, oh man, we have great sex. Don't worry, we want it. We might say that out loud, but in our own brains, we're like, oh God, okay, I got to be ready for this. I don't really feel like it, but I got to do it because I have to perform because I can't let her think I'm not into this. What's she going to think about me? What's my wife going to think if I don't want to have sex with her anymore? So it's very important I get men to get their hormones checked. And I'm giving out Cialis like it's candy. I think every person I see, I would give to Cialis to. There's very few people I would not use it on. There's only a few times I'd say, maybe not a good idea. So I love using daily Cialis in men. Again, this comes back to the fact that you might have some heart disease, so then we have to work on heart disease. What do I do for this? Hey, GLP-1 now. You're overweight, you're obese. It is a lot harder to get erections because you don't have enough blood flow because you're overweight, and now you have more heart disease. So here's where the GLP-1 comes in. Hey, I'm gonna throw you on a GLP-1. I'm gonna get you testosterone. I'm gonna put you into tadalafil. I'm gonna put you on three things to help reduce your risk of death, improve your blood flow, and improve your body's ability to, get an erection and your libido. So now we have better sex. I had a woman somewhat recently talking to her and her husband, and the guy had been on daily tadalafil. And I mentioned to him something about, hey, like, you're on tadalafil. And he goes, well, I was taking it for a little while. And his wife goes, yeah, you stopped. I really like that tadalafil. Why did you stop? And I'm like, dude, your own wife is telling you to be honest. What I don't know what else to do. I could sit here and tell you all day, but if your own partner is telling you to do it and you're not willing to do it, I know what to do. And I'm like sitting there trying to like convince him, like it's not just because I think men get in their own heads. Like if I on this stuff, I need it forever. And I'm like, well, you also need testosterone forever. You also need, yeah, this is not a bad thing. I see medicine as a longevity, I guess, care, anti-aging care is you're just trying to slow down this slow degradation. All we're trying to slow it down. So yes, there are some things we'll be doing long term. You don't go to the gym once. You don't eat one healthy meal. You do this day in, day out. Consistency of the things you do every single day that make you who you are. So if you want to have a better life, you want to have reduction of heart disease, you want to have better sex, you have to get the lifestyle pillars in first: diet, nutrition, exercise. All three of those are also going to help men with erections and libido because they're going to have somewhat better testosterone. Again, we still need to use some of the things we have at our hands medically, but overall, I hope that answers the question.
No, Jason, thank you for talking to the men because I think you're right. A lot of them don't want to talk about it. There's,
No.
it's an uncomfortable conversation to have. Now, can you talk to us about PT 141 for
Oh,
men,
yes.
FDA approved for women, and but it also helps men. So,
Yeah.
can you talk about that?
Of course. So PT-141 is on label for women for hyposexual dysfunction disorder, which is HPDD, HSDD, sorry. And it works for women very well, increasing libido. Guess
Can
what,
you
men?
tell us how it works?
Yes,
Its
yes, yes, yes,
mechanism of
yes.
action in
Of
simple
course,
terms.
of course. So it's a melanocortin receptor agonist. It's going to work on the melanocortin system. Basically, it goes to the hypothalamus and drives just increased libido. It just straight goes to the brain and says, "Hey, you want to have sex more." There's no change in hormones. There's no change in anything. The only thing it's doing is going to the brain. We found a receptor in the brain. Of course, we found it because we've been looking for this for such a long time. We found something that just makes you want to have sex. This is all it wants to do. You just want to have more sex. So men, better spontaneous erections, right? So I was saying this earlier that 30% of men do not get erection improvements from being on Viagra, Cialis. Some of those men, in fact, a large portion of them, it's libido. You give them PT 141, and those men have spontaneous, better quality erections. I'm always telling men pairing PT 141 with your daily Cialis is the best thing you can possibly do. I love PT 141. I can't say enough good stuff about it. Some people do get a little nauseous with it. It does have some flushing that comes with it. It is on label for women, but it works absolutely amazingly well in men. So men, I do recommend PT 141. Even if your testosterone is great, I have some men that have great testosterone, they want some more. They want like, hey, how can I get this even better? So I dose it two different ways. I will give it as needed. So it is a as needed option. You can use it before you have sex to increase some sex drive. Or you can use a daily dose of it 5 days a week, low dose between 0.25 milligrams and zero point 0.5 milligrams is what I use in patients. And you use this every night before bed. You wake up having better sex drive. So typically in the morning is the highest level of testosterone in men. That's why men love morning sex, because in the morning you wake up, your testosterone is really high. You get morning wood, you get morning erections. This is all what's supposed to happen. You throw in PT 141 in there,
Waiting to take notes.
first thing in the morning, guys. If you want to get get the best loving, that's when it's for men. So I always tell my men, it's a good time to use it before bed because again, you wake up with a better sex drive in the morning and be more rambunctious, I guess. But PT 141 does increase that libido, but realistically, it does very much help the erection quality in men because libido goes up. Like I said, for many men out there, I don't know how to say this, I guess politely, but when you get married, just like you having a red M&M. And men only want red M&Ms for so long before they finally say, I want a green M&M. So to get yourself back and interested in red M&Ms, you might want to take something like PT 141 and get excited about the person you have with you. And as we age, also our libidos wane. They just go down, period. Testosterone goes down. Our excitement for life, excitement kind of goes down. Testosterone is a great booster, but if you don't have testosterone right now, a great option for men that don't even have T, they can take PT 141 and still have the libido increase and still want to have sex. I have couples who use it for the weekend. They're having their honeymoon. They're having their anniversary. They're having a birthday weekend, whatever it is. And then like, well, I want to be more interested too. And so they're taking it as well as their partners, and they're having really great weekends and bringing some better intimacy back.
Well, we've got the thrill pill that combines tadalafil, PT-141, and oxytocin. So we've got
Oh,
something.
love the oxytocin. Oxytocin is a great one for men and women. It's going to increase the same things. In fact, that pill would actually work for men as well. Here, strangely, you throw some PT 141 in a man, you throw some oxytocin. Oxytocin also increases libido, and then you throw in some is that Cialis tadalafil in there. That also is going to improve. So for women out there that are getting the thrill, it's a pill, right? You're taking a pill.
Well, it's a troche. It's a
Trophy.
troche.
Okay, great. Men can take it too. Like that is a very much men go at it. Go ham. Take this. It'll work for you just as well as works for women. I do tell my men, women, you're tricky. You women are very tricky when it comes to libido and everything else. There's multiple layers of libido. Men, it's very easy. They give you testosterone. Okay, we're better. Then they give you some PT 141. You're better. Give you some Delphi. Like that is like fixes almost every man out there. When a woman comes to me with low libido, I'm like, it could be so many different things. What's your stress level? Do you like your partner anymore? Are you unhappy at work? The level and desire for women is very easy to change based on all these different factors. There's so many things. Do you have enough progesterone? For men, testosterone, PT-141, daily Cialis, or Viagra, and they're off to the races. So
Wow.
they could take
Guys
the
are
throw pill. If
so-
you women out there want to get your man something, maybe gift them a little couple throw pills and see how they like it.
I know Christmas is right around the corner.
Christmas
Uh,
in July. We're Christmas in
I
August.
know.
Christmas all year round, guys. This is not
That's
a
right.
once a year. It's Christmas for you too, women, right? This is not just for the men.
I know. It's a gift that keeps on giving. All right, let's shift gears and talk about GLP-1s. Can
Okay.
you talk to our men and tell us how GLP-1s work? How does it affect their bodies? Is there a difference between how they affect a man's body versus a female body? And
Um,
the effects different for men versus women?
no. Short answer, not really any different. They're going to work in men as well as they work in women. There's no sex difference. It's not like if I give a woman semaglutide and I give it to a man, I see men having different results. Now, will men lose more weight? Yeah, they weigh more. Most men weigh more than women. So there will be, I always say with women, what's my husband took this and he lost 15 pounds in 2 weeks and I lost 3 pounds. I'm like, well, you're losing 10 pounds and he's trying to lose 30 pounds. Like there's a little difference between the two. Um, but between men and women, GLP works the same, right? We're going to slow down gastric emptying. We're going to go to our brain and say, hey, we're full. And we're going to increase insulin sensitivity and we're going to have more fat oxidation. So there's multiple layers to this, slowing down food, how much we want to eat, burning more fat off, and then also helping our insulin resistance so we can actually get more sugar into the muscles, into our bodies, so we can utilize this for helping things like muscle growth. There are many reasons to be on GLP-1s, and for men out there, I think it is a phenomenal benefit. It is so crazy that I see my men come to see me and they're overweight. And they're like, well, I'm here because my wife wants to lose weight. She's here to listen. And I'm like, dude, you also have like 30 pounds to lose. Like I can see it through your shirt. Like this is not something that you shouldn't be embarrassed about. You should also ask for the same thing. Because men, look, heart disease is a massive problem, right? This is the number one kill in the United States. You want to reduce your risk of heart disease? Number one killer, lose weight. Very simple. And we have an option. GLP-1s are going to work in men as well as women. Again, I think society puts a lot of pressure on women to look good, to stay thin. With men, you get gray hair, you look better, right? Men get old, they get wrinkles, distinguished, right? We always put these words around men as they age and allow men to just keep getting older and getting more and more weight. We don't say anything. But we, God forbid, a woman gains extra weight, all of a sudden, every single person's like, "Oh, did you see how much weight they gained?" I mean, this is like media does this with us. So I do want to understand weight gain is not good. We do not want extra visceral fat. We've talked about this earlier. I said visceral fat leads to insulin resistance, leads to heart disease. You have increased cancer risk by being overweight. So when men talk about these things, I'm trying to say to them, look, just your risk factors for death go up when you're overweight. 70% of men and women are overweight. There's just no difference. This is affecting every sex out there. And for men out there who are worried, I'm going to take a GLP-1. Oh, it's not manly enough. Like I don't need a GLP-1. I can do this. I have plenty of men. I can do it myself. Great. I encourage every patient I have, if you think you can do it yourself, go do it. Give it 3 months, 4 months, 5, 6 months. Come back and see me. We'll talk then. I do this all the time. I don't want anyone to think I'm stepping on their toes and telling them what they should be doing. But I do want men to have options. And GLP-1s are an option. They are the training wheels to get you where you want to go. They are not fixing everything. I'm sorry, GLP-1s are great. I will be on them the rest of my life, but I want it for the long-term uses for just reduction of heart disease and Alzheimer's and Parkinson's, all these things that affect men and women. But the biggest thing is the training wheels go on to get the lifestyle. And we talk about lifestyle to start with diet, nutrition, exercise. These are your pillars to begin with. And you start a GLP-1, you can start working on those things. It's giving the ability to kind of like get on the bike and be like, hey, what kind of diet do I want to work on? Hey, I'm eating less food. What is this going to look like when I come off? Right? We can't suppress appetite forever. I have patients that, say, well, I just want my appetite to stay down forever. That's not realistic. It is not realistic to have a low appetite suppressed all the time. GLP-1s stop working. That's why there's an upper limit to how much weight loss there is. It's about 15 to 20% with sema, about 18 to 23% with tirzepatide. That's it. They stop working. So you can't suppress appetite forever and get to this weight that, keep going down and keep taking it forever. You do have to eventually come down off these GLP-1s or at least reduce them because they're not going to work force suppression of appetite forever. So this means getting things in place. What's my exercise routine look like? This is when we pair everything, right? The thing that I think EllieMed's going to come with next, or EllieMD is going to show up next, honey, is going to be all the ways to improve testosterone men. I'm waiting for that to come out next because we pair GLP-1s with testosterone. I mean, my clinic is full of hormones and GLP-1s. That is like listen, I talk on Instagram all the time about these super cool peptides. Hey, man, you have problems recovering, you're getting older, BPC 157 is a great place to start. You can't get on testosterone, BPC 157, right? You're having problems with libido, PT 141. We have options if you're not getting on testosterone, but we need some of these things in place to continue this journey. This journey on a GLP-1 is going to end at some point. What is in place to continue that going? This is when we very much have to explain lifestyle changes. And I know it is so hard, but the benefit of a GLP-1 is it reduces cravings. It works in the dopamine reward center. So guess what? I have patients come off and say, I don't feel like eating that same stuff I ate before. Like my want for these sugary foods, for these things has changed. If you change your dopamine reward center for 100 days, you take 100 days going away from some kind of addictive thing such as sugar, it changes the way the neural network is. So now you see changes in the way you even look at food. Again, any addiction, once you go back to it, you can get right back at, but at least you've broken the addiction to start with. So GLP-1s for men is massively being missed because enough men are not going to the doctors and asking for this stuff. They're going in and saying, I'm fine. I don't have a problem, and you're like, dude, you're 45 pounds overweight. What do you mean you don't have a problem? Your risk of heart disease and cancer. Do you have kids? Do you want to live to see your grandkids? Like, yeah, this is what you need to do, man. Like, please do something. We see men dying earlier in real life because of this. Men don't go to the doctors. They don't get the help they need. They don't continue with the stuff they're on. I don't know what it is about men in healthcare, but they don't like long-term things. They don't want to be honest in the long term. They just have such a ick to it. And my women understand it. Like I said, you women just get it better than my men, unfortunately.
And we talk about it amongst ourselves with our girlfriends a lot of times. And I don't think men talk about these things.
Oh,
Talk
I
about them.
don't think any of my men have ever talked to me about erectile dysfunction. I have no guy friends, and I'm like, dude, my dick isn't working. It's a problem. I mean, only because I do this for a living do I ever hear this ever
Yeah.
from a man. But I guarantee you, I can promise you, no man ever seen nothing with a man. So my dick stopped working. It's not really doing the same thing it used to. Are you having this happen? And women, you share this, you share the most intimate details with each other. You guys share everything. Has your libido gone down? God, my libido's not as good as it used to be. You guys share every little detail. And then it's like, nice weather today. Ugh, it's
Yeah.
supposed to rain this week. How the Cubs doing? If you watch that Bears game, that's literally how men bond. It is so difficult to get men to talk about this stuff. And I wish men would come to the table and saying, I've really not been. They'll talk to me, right? Because this
Well,
is
that's
what,
why you're here right now. You're
yeah,
talking.
yeah. My
We're
friends, my
starting the
friends will talk to
conversation.
me. I mean, my friends tell me the weirdest stuff. I get the weirdest messages from my friends, but I don't get that in men normal life, right? I might be sitting talking to a guy next to me. He's like, "Yeah, my dick, it's not working well." And the second's going to just shh. I don't want him to know. I'm like, don't know you erectile dysfunction is normal. We all get it. Like every man in this room we're in now will have it most likely at some point. But men just don't want to discuss these things. They're not talking about heart disease, not talking about risk factors. No, every man's so afraid to say, my libido's gone down. We all have to pretend like that chest beat, like I'm still a man, I'm still a man. And we'll check the testosterone, testosterone's low. And then once this has been the joke I tell my guy friends. I'm like, look, we can run and everyone's testosterone here. We can tell you who's got the lowest testosterone. But the problem is if I do that, the men will make fun of each other. Right? If this was a group of women checking testosterone, like, oh my God, you're so low. I'm so sorry. Like, you have the worst one. Like, that's really sad. Men will be like, ha, you're the worst one. I got the best. God, I'm 750. You're such a little baby. That sucks. Men don't support each other the same way. We just don't. My group texts for my men are we rip each other apart. We just totally are brutal to each other. My women, they have group text messages with each other. I'm sure all the women are like, oh my God, you're having a hard time. Let me support you. My men are like, you're having a hard time? I'm gonna kick you even harder now. Now tell me how it goes.
Well, we're
So I
gonna
do
change that.
and then I want to change. I very much personally, I tell my guy friends I'm grateful for them, and then I get made fun of, which is totally normal. But I do this stuff because I do want to make it better for men to be able to come to the table and say these things. I think it's super important, especially in health, for men to recognize and talk about the things going on in their life. Because guess what? You might have a friend who's suffering the same way you are, and maybe he got something to do for it. And he's not going to tell you because he doesn't know you're suffering from it, right? He might have gone on testosterone, got a GLP-1, might be losing weight, and like you're afraid to ask this guy, like, what are you doing to lose weight? Nothing, just diet. And we're so proud as men. So like we don't even admit that we're on these things to lose weight. We don't want to admit that we're on, tadalafil or Cialis. It's only when I talk about it openly like this, guys are like, oh yeah, I take Cialis. When you bring it up in an open room and it's brought up, men will speak about it. The problem is men, no one wants to talk about it. It's such a hush hush thing for men about our healthcare. And unfortunately, that's leading to more disease. That's leading to people feeling worse. That's leading to men not getting the care they need. And again, we talk about health span every single day. Health span just keeps going down for men. And we aren't doing anything to make it better, unfortunately. Really missing out on this long-term care for them.
Yeah, thank you for speaking to us. There's a lot of women on this call, and it's really good for us to also know what men are going through psychologically, emotionally. It's really nice for us to understand. Real quick, if we could go back to the GLPs, just one question, because a lot of men are concerned about muscle mass
Oh,
loss
yes.
while they're on GLPs. Can you
Mhm.
address that and talk about what happens with muscle
Correct.
mass?
If you were just given a GLP-1 and you were giving absolutely zero information about it, just someone guess, here's your GLP-1, start injecting next week. you will lose a lot of muscle mass. It just will happen. But if you're counseled and someone sits there and says, you need to increase your protein content, you need to exercise, you need strength training, 3 to 4 days a week of strength training, at the minimum, just walk 3 days a week. Give me 30-minute walks 3 days a week. That's the minimum I ask for. I want strength training, but some men, some women, whatever, won't do it. So you need to have improvement in your protein. Again, zero point 0.8 to 1 gram per pound of ideal body weight. I do change that if you're trying to lose 100 pounds. I might give a little higher protein recommendations about that. Um, you must work out and you must stay hydrated. So those things, then I'm saying, where's hormones? Hormone optimized. As we get older, again, hormones go down. If you're a 6-year-old man going on this, your testosterone is in the toilet. It is really difficult to hold on to muscle mass in general in your 60s. So getting hormones checked. The next thing, if you don't have access to hormones, but you're with EllieMD, Tesamorelin, Ipamorelin. It is wonderful at holding muscle mass as you go down. Growth hormone will improve muscle mass. It'll hold muscle mass much better. So if you want something, the bare minimum, some growth hormone peptides, growth hormone releasing hormone, growth hormone releasing peptide, mixing those together with testosterone and ipamorelin will also hold it. So we have protein and we have exercise, the two things you can do for free at home to help improve and hold muscle mass. And then you want to throw something like hormones at it, such as testosterone. And then the best of all, throw in something like testosterone, right? So if you don't have access to testosterone, get on some testosterone. If you have access to testosterone, still get on testosterone. I'm still recommending to patients. I do know that between testosterone and ipamorelin is the ghrelin agonist. I know we have LMDs releasing this now. It does have in some people some hunger increases, so we don't want to be a little careful with the GLP-1. But I'm going to bet at some point our fearless leader here, Honey, will probably figure out a way to get just testosterone by itself and have zero improve any hunger issues. And testosterone by itself is great. The testosterone ipamorelin is better. I will say it's definitely going to be a stronger push to growth hormone and IGF-1, meaning it will work better. But there, in some people, in a select few, hunger might increase a little bit. So in those patients, sermorelin is a great option. So you can still give sermorelin that has no hunger, but testosterone by itself would have no hunger as well. So you don't have to worry. Most people don't get hungry on it, but it can happen in some people. So again, Honey will sure come out with a testosterone blend by itself
Well,
before too long, I'm sure.
it pairs very well with the GLP-1,
Of
so
course it does. It goes wonderful. They
that's
go
a
very synergistic.
added product to the cart. Now, you've had your own physical transformation, and you look wonderful. If you guys don't follow Dr. Jason on Instagram, you better go and follow him. But you've had your own body transformation. We want to look as good as you, if there are anybody.
And I want to do it. That's what I'm here for. That's
Okay,
why I'm helping. I'm so excited.
but what do you use? We want to know your peptide stack. What do you
Oh
use on
yeah.
a daily basis?
I'm on enclomiphene. So enclomiphene, hopefully, honey can bring that to the table for men. It is going to increase testosterone levels in men. I'm currently on GHKCU, great for skin, hair, nails. If you aren't taking GHKCU, ladies, please get on it. Skin gets better, your nails grow faster, your hair grows better. I take BPC 157, and I take weekly semaglutide. So those are the four things I run year round, no matter what. And I also run testosterone and ipamorelin myself. So I'm on testosterone, ipamorelin, semaglutide, GHKCU, BPC 157, and I take daily Cialis. So like that's my big stack that I go to every single week. I take an AD as well a few times a week. I just took some today before I worked out, posted a little story on it, just saying it's my pre-workout. So I do use NAD as well. I think it works phenomenally well. I cycle in and out of things throughout the year, depending on what I'm trying to work on. But that's like my go-to all the time, non-negotiable. That's what I take and have been on for at least about a year and a half now.
So as far as the semaglutide goes, do you do it, you microdose it, I'm assuming. Do you do it weekly? Do you do a little bit every day? How do you
Yeah,
like?
I do. So microdosing, I know I got into this someone yesterday because I just made a video on microdosing. Technically, microdosing, for anyone out there that wants to argue on this, microdosing is below the actual dosing of the drug. So I know, honey, I think you guys recommend 2.5 or 50 units for tirzepatide, is what I was told yesterday or today by someone.
Mhm.
Technically, you could turn that into a microdose. You could split 25 and 25. Now you're doing microdosing, doing just a little bit, a couple times a week. That would be considered microdose. I consider 2.5 milligrams a microdose of tirzepatide, but anything below weight loss, really for me, is going to be microdosing. So for me, I'm doing zero point 0.5 milligrams of semaglutide. I will run my patients anywhere between zero point 0.1 to zero point 0.5 milligrams of semaglutide. And that's between 1 and 2 times a week. So you can inject it more than once. It's just less injections is better for most patients. And then for tirzepatide, I'm doing between 1 milligram and 2.5 milligrams. Again, I understand the bottom dosing is technically not considered microdosing for anyone out there. But for me in my practice, and that's how I use it. So again, you could split these dosage up. You could do it twice a week. Some people notice by the end of the week the effects are wearing off. So I just say, hey, split it up, do it times a week. I mean, you can do it more frequently if you want. But the half-life for these is about 5 to 7 days. They do last throughout the whole week.
All right. Well, Dr. Jason, we're at that time. Do you have any last final words for our men on the call or the husbands who are listening, the partners? Do you have any last final words?
Get your hormones
Guys.
checked,
Okay.
sleep better,
Okay.
drink more water,
Get a
work out,
filter.
exercise, and eat the foods on the outside of the grocery store.
All right. Well, there you go. That's about it. Thank you so much for tuning in. To all of you and Dr. J, thank you so much for coming on and educating our community. We appreciate you so much. This is now your third or fourth time in our community, and these calls are wonderful. I've gotten raving reviews, a lot of great feedback. Thank you for being part of our
Of course.
community. Thank you all for tuning in tonight. We'll see you same time, same place tomorrow. In fact, we're having our educational series. So thank you all for tuning in. Have a wonderful night. Good night. Thank you, Dr. J.
See ya.
Oh, thank you. Bye-bye.